everybody, and welcome back to my channel. I know it has been a minute since I've made a video, but I'm really excited to be here today presenting you with the 7 warning signs of breast cancer, and I'm so excited to introduce my amazing colleague and my really good friend. Her name is Dr. Dani. She's a board-certified general surgeon, and she specializes in caring for patients with breast cancer. So she's the type of surgeon who would do mastectomies, removing breast lumps, amongst many other things that she does. Her specialty and what people really come to see her for is breast issues. So I thought she would be the perfect person to discuss the warning signs of breast cancer with. And, I kind of wanted to just jump into this video by saying I feel like we are seeing just a huge uptick in young patients with breast cancer. We see patients getting mastectomies and reconstructions who are in their 20s. And the first question I have for you is why? Why are we seeing patients who are so much younger with breast cancer these days?
Yeah, I think it's really difficult. I think it's multifactorial. I think there are a lot of theories as to why we're seeing younger and younger patients, but I don't think there's really one known factor that we can point to that says this is why this is happening. We think that awareness, number one, is much increased.
People are more aware, so they're doing their own breast exams,
right? And they're coming in for certain things. I think, just as in anything, we have to look at our environment. We have to look at our food sources, at the things that we're exposing our body to. And I think that those things are all part of the factors, but I also think that, family history is really the most important thing that I think about when I look at breast cancer risk. And so I think we're just seeing a big uptick in younger patients. And I don't know if that's because the population is just growing in general. Again, it's hard to know exactly why that's happening.
The one thing I always think about is like plastics. Everybody's always talking about, plastic leaching from the plastic bottles that we drink out of and all of that kind of thing. Do you think that that's a risk factor? Do you think that the fact that we're using so many water bottles and things like that are contributing to this risk?
I think that that's certainly something that they're looking at, and I think it is, again, responsible for multiple different types of cancers and not just necessarily breast cancer. But I think that, breast cancer is the most common cause of cancer in women, right? And so it's just, there's just a lot of us, and I think that that's why that number is so high.
Right, so the take-home point kind of for me here is the reason that we're seeing so many people with younger breast cancer is because we are more aware, and that's part of the whole purpose of this video. I want everybody to be aware because she just said we're checking ourselves earlier, we're checking for lumps and bumps and all the signs that we're going to discuss in this video because that allows for earlier diagnosis, earlier treatment, and in many cases it seems like from what I see from you, treatment is just either a lumpectomy or a mastectomy with no chemotherapy, no radiation. Obviously sometimes there is the need for chemotherapy and radiation, but earlier detection means that you can be done with it with just a resection more quickly. So that speaks to the importance also of early detection. You find it before it spreads.
Right, most definitely. I think that that's certainly true. I think what we've learned though is truly tumor biology is the key, right? So size of breast cancer and detecting cancers when they're small is definitely important. But one of the things that we've really learned is that small aggressive cancers are as dangerous or even more dangerous than large, more non-aggressive cancers.
So interesting. So the size of the lump does not necessarily correlate.
Doesn't always equal treatment options.
Right.
Correct. Exactly.
Super interesting.
Exactly.
Okay. First of all, how young should people start doing self-breast exams? That's my first question. And what is the best way to do a self-breast exam? I know I've always heard in the shower, but does it have to be in the shower? Can you talk to us a little bit about that?
Absolutely, yeah. So, what I tell all my patients, and especially, I get this question a lot from my moms that I see that, have younger girls that, they themselves have been diagnosed with breast cancer, so they want to be able to pass on information to their children so that they can be more aware. And what I always tell them is that, body self-awareness can start at any age. There's no right or wrong time to start doing that. So, I encourage girls, even in their young teens to
just to make a habit of it.
Exactly. Exactly.
If you're doing it once a week in the shower, you get to know your breasts, you get to know what's normal, you get to know what doesn't feel normal.
Right, and I think that's the most important thing is just learning your own body, right? Because we're all made differently, and so I think that just learning yourself is super important, and that can happen anytime, right? There's no right or wrong time for that. We also talk about, other risk factors. So women who have a family history of breast cancer, it is recommended that they start getting some type of screening 10 years prior to the youngest family member that was diagnosed, right? Okay. So let's say your mom mom, for example, was diagnosed in her early 40s. Let's say she's 43. So 33 is really when the time that you should be getting, formal breast evaluation by your practitioner. Well, not necessarily a mammogram. Ultrasound is typically used in younger women because it's better for dense breasts. And so we don't typically like to do mammograms starting that early. But we do recommend getting ultrasounds, and we also recommend just getting a good clinical breast exam by someone who is, who's trained in that.
Right, who knows what to look for.
Exactly. And so your gynecologist is perfectly capable of doing that when you go in for your annual exam. But that 10-year rule is kind of what we use for the beginning of screening in patients that have a family history.
Okay.
Right? In patients that don't have a family history, I think it's important still, as we get older, again, to get a yearly clinical breast exam typically done by your gynecologist when you go in for your annual exam, right? And then based on typical guidelines, the guidelines would be to get your first mammogram when you're 40.
Okay.
And then yearly after that.
So to summarize, tell me if I've got this right. So never too young to do a self breast exam. It doesn't matter what age you are, start doing that as in your teens so that you get used to doing that every week. If you have a family member with breast cancer, then we recommend that you do a screening of some sort, whether that is an exam by your gynecologist in your yearly exam or some kind of ultrasound, 10 years before the age that the youngest family member with breast cancer got breast cancer.
Correct.
And then start getting mammograms around 40.
Correct.
And that's if you have a family member with it, or if not, you still start at 40 every year with a mammogram.
Correct. Some women will, if they're, let's say they've had a super young family member, someone in their 30s, right, that has had breast cancer, a cousin or a sister or someone like that, then, they can just really, I think it's an individualized discussion that you need to have with your healthcare professional as far as what you want to do for your screening evaluations. We can, again, start getting imaging as early as in our 30s, but again, typically ultrasound is used. We don't typically get our first mammogram. There was some discussion at some point to get a baseline mammogram between the age of 35 and 40, but really the healthcare guidelines say age 40 is the appropriate year.
Okay.
Correct.
And when I go get my mammograms, they always say, do you want the 3D one? And can you tell us a little bit about like 3D versus non-3D mammograms?
Yeah, absolutely. So, the vast majority of imaging centers have moved to using 3D mammograms. It's just the standard technology now. Some don't, and some will only have 2D, and that's okay. The digital imaging that we have, even 2D, is far superior to what we what we had in the past.
Right.
And so, even a 2D mammogram is better than nothing. And so, I think 3D is always something that you can ask for, and we do think that it is better. It is specifically better in women who have dense breasts, and so that's an issue that we can certainly talk about, is the density of your breast, because I think that influences a lot of these decisions.
Okay.
As far as what imaging type and things like that you get.
And younger people have more dense breasts.
That's correct.
Right.
For the vast majority of the time, that's correct. And so 3D mammography is important in that regard. I think the other thing is that, again, with dense breasts, we can always add ultrasound to that, right? So we can do a regular mammogram, even if it's a 2D mammogram, and then we can add an ultrasound to that. And that also increases our accuracy and helps us be more, just not missing things.
Right. So we have lots and lots of modalities then
Correct.
to evaluate and find breast lumps early.
Correct.
So, the big thing that I just want people to take home from this video is, what are the things that I should look for? What is the number one most common thing we see with breast cancer as a presenting symptom? And I think a lot of people think that it's pain. Like, for example, a friend of mine had pain in her breast, and, she went for a mammogram, and amazingly, they found cancer, but that is actually not the most common symptom for presentation as I understand it. So what is the most common symptom we find upon diagnosis of breast cancer?
Yeah, I would say it's a palpable lump, right?
Okay.
It's specifically in patients who are young, as we talked about. You mentioned the young patients. So young patients typically are not getting imaging, right? So, in a woman over 40, the most common presenting symptom for diagnosis of breast cancer is actually an abnormal mammogram, right? Okay. So abnormal imaging. But in a younger woman who's not getting routine imaging, the most common symptom is a palpable mass in the breast, right? So that's what we would see first.
Okay. Yeah. What about a mass in the axilla? The axilla is kind of a fancy name for your armpit. So what about lumps in the armpit?
In the armpit, yeah. So those are typically unfortunately later signs of breast cancer, right? Because the mass typically starts in the breast, and then as the cancer grows, it can spread to the lymph nodes under our arm, right? So they're axillary lymph nodes is what we call those, and those we can feel sometimes. And but again, that's typically a later sign. We see palpable lumps under the arm for a lot of different reasons, most of which are not cancer related, right? Most of which are things that are in the skin, like little infected hair follicles or sebaceous cysts, or things that are benign that aren't cancer related. That's typically what we would see as a palpable mass in the axilla. Again, we see that at sometimes presentation with breast cancer, but again, it's typically a later sign.
Okay. Yeah. What about changing, skin signs?
Absolutely, yeah. So some of the things that we can see are some, we call it like dimpling, or there's actually puckering of the skin. So if the mass in the breast is very close to the skin, it sort of pulls the skin in and it kind of tethers the skin to the mass. And so before you would see any dimpling or thickening of the skin, you can see that we kind of call puckering or tethering of the skin.
Okay.
The thickening of the skin that we see, we call peau d'orange, which means peel of an orange. It's what it looks like. It's this bumpy sort of texture to it. And what it really looks like too is that the pores of the skin have just gotten very large, right?
And what causes the enlargement of the pores?
Well, it's not really that they're not enlarged, but it just looks that way because what it is that the cancer has invaded into the lymphatic system of the skin.
Okay.
And that's what causes that appearance. And that is, again, typically, unfortunately, a pretty late sign of cancer, but it can also be a sign of a very aggressive type of cancer called inflammatory breast cancer. And that's usually associated with those thickening and sort of changes in the skin like that, in addition to redness in the breast, sometimes associated with pain. So there's a lot of different variation in how that can present.
But any abnormality is something that is worth getting checked out, it sounds like.
Yes.
Like anything that doesn't look right.
Because I think one of the biggest take-home messages for me is that this is on a spectrum, right? People can present with very, very early signs, or they can present with very, very late signs. And I think that's, we have to be aware of those different things. And so if you see something that you're questioning, definitely come in, be evaluated, get seen, and have it looked at so that you can feel good about what's happening.
Okay.
Yeah.
And then let's talk about like nipples. You hear about like inverted nipples or, nipple scaling or nipple changes. Are these things that people should think about?
Yeah, most definitely. So, inverted nipples are an interesting topic in and of itself because it can be a normal anatomic variant. Some women just have them. That's how they're made. And, they'll have noticed that that's how their body looks from the time that they started developing their breasts. And so that can be a very normal thing and not dangerous and not worrisome or concerning at all. If it's a new symptom, if your nipple wasn't inverted before, it was normally out, but now has become inverted, that is definitely something that needs to be evaluated. There are benign reasons that happens, but there are also, can be commonly associated with a breast cancer. And so again, something we should certainly evaluate in anybody. Nipple scaling, nipple rashes, these things are very common. I see them very, very frequently. And more often than not, it's a simple dermatitis. It's a simple irritation dermatitis.
So you can get that on your breast.
You can get that on your breast.
Okay.
Our breast skin is just like our skin anywhere else. Right, exactly. But it's frightening because it is on our breast. And so we can get that evaluated. Very commonly we'll treat that with a topical steroid just for a short period of time. And if it resolves, then we know it was just simply, inflammation or, irritation, exactly, something like that. But if it doesn't resolve, then very often I will do a biopsy of that skin to rule out an entity called Paget's disease. That's what is associated with.
Hey, I did research on that
exactly.
Well, when I was an undergrad. That's really interesting. The last thing I wanted to talk about in terms of nipple things are nipple discharge. Obviously in our lives, the most normal type of nipple discharge we are used to is either colostrum or breast milk. Obviously, that's a normal thing, but let's talk about if you see nipple discharge outside of breastfeeding.
Absolutely. So it's very common, first of all. I will tell you, I see it probably almost every clinic. I see a patient that has some type of nipple discharge.
Okay.
So it's a very common thing, and I think that's a misconception. I think when it happens to us, it's something that no one really talks about, and so it's not really something that we're made aware that can be normal. But, by far and away, there is, we call it physiologic nipple discharge, and some women who have lactated in the past will just continue to have that happen. And so we kind of divide nipple discharge in two different categories. One is spontaneous. That is, it happens on its own, right? You see a spot in your bra when you're in the shower. You see something come out. You've got a spot on your nightgown, things like that. Those are the things, the spontaneous nipple discharge is what we worry about. If you can only see the discharge with manipulation, meaning you have to work to get it, that's typically what we call physiologic, and that's nothing that we worry about.
Okay.
It's most common bilateral. It happens in both breasts, and when something happens on both sides, typically means it's physiologic, and it's not anything that we would be overly concerned about. So unilateral or one-sided discharge, that's going to get our attention. Clear discharge that is not milky in nature, right? Milky in nature, again, is that physiologic stuff, and it just kind of happens. And for some reason, some women will continue to have a little bit of that even as time goes on. They say, I've seen ladies, I haven't breastfed in 20 years, and now I have, it's like, I know, it happens, and it's not anything to worry about. It's most likely hormonal, those types of things. But one-sided, clear discharge, or bloody discharge. Those are the things that we need to evaluate. Those are the things that we need to pay attention to and be seen. Now, again, they are most commonly caused by a benign problem in the breast. So not cancer, actually. Nipple discharge can happen in breast cancer, but again, that's typically a very late sign of breast cancer. So a woman has to have a pretty large, far advanced cancer before they would have nipple discharge. But again, benign causes of nipple discharge. The typical thing is called an introductive papilloma. So it's just a benign little thing. It's like a polyp. It's like you have a polyp in your colon, that they remove when they do your colonoscopies. It's a little polyp that forms in the duct of the breast, and it produces this discharge. Most commonly, it's recommended that we remove those. So usually that would involve some type of surgery to get rid of that. But again, it's a benign problem. So it doesn't have to be terrifying.
Right.
I think that's an important thing.
Amazing.
Yeah.
Okay.
Yeah.
And then lastly, I just wanted to talk about a change in breast size. I mean, I know, my uncles are plastic surgeons, and I used to work with them. You used to work with them. We used to work with them all together.
Yeah.
And one thing that they always said were that the breasts are not twins, they're sisters. So it's normal to have breasts that are not exactly the same, but let's talk about change in breast size as a risk factor for breast cancer, something you need to think about.
Yeah, so I see this, again, fairly frequently. I have patients that come in that say, why this one breast seems larger, it seems more swollen, why is that? And most often it's not cancer related. Most often it's a hormonal issue. And you say, well, why is it only if it's hormones, it should be everything in my body. Why is it only affecting one side versus the other side? And the answer is we don't really know, but we do see that. We do see some patients that will develop an asymmetry over time. As you said, most women, when they develop, our breasts are different sizes, right?
Okay.
And so it's again, normal. Most women, it's not something that you would notice, like it's certainly not something where you'd have to have a different cup size or, just a different size of bra or something like that for one versus the other. But just a normal part of our anatomy, basically. As far as when you see something change, if you notice that your one breast is becoming larger, more importantly, honestly, is the breast would become smaller, okay?
Oh.
Yeah. So sometimes cancers can grow and they cause the breast to contract. Exactly. That tethering situation. So they kind of cause the breast to contract a little bit. So if the breast is smaller, again, that's something worth investigating.
Okay,
exactly.
Super interesting.
Yeah.
Okay,
Yeah.
So let's summarize this. So the things that we should look for, let's go back to the very beginning and just do like a bullet list of important things.
Okay.
One is that if you have a family history of breast cancer, you're at high risk for breast cancer, and it is absolutely worth seeing your doctor early to set up a plan kind of for life evaluations of your breasts to make sure that if you do get it, you catch it early, and we can talk about this in another video, some people choose to have elective mastectomies in situations where they have family members with breast cancer. I think that's probably a subject for another video, but you should start doing breast exams as early as possible just to make it a habit.
Right.
Get a exam done by your doctor yearly and possibly a ultrasound 10 years before the family member that you have, the earliest,
Correct.
the youngest family member that you have developed breast cancer.
Yes.
And then get your mammogram starting at 40 every year after that, and it should be 3D. And the things that are worth looking into, the changes that are possible signs of breast cancer that you shouldn't ignore are a lump in your breast, certainly a lump in your axilla or a lump in your underarm, redness in your breast, a change in your breast skin like thickening or, you know, peau d'orange. You said it so much better than me. It was like so sophisticated. If you have a shrinking breast, so a change in breast size, but more importantly, a breast that gets smaller.
Right, rather than larger.
Right, interesting.
Yes.
If you have nipple inversion or nipple discharge or any kind of nipple change, those are worth getting investigated. And I think that's it. And, you know, pain, certainly if really quick, just circling back to the whole pain thing.
Yes.
You know, certainly pain's not the number one sign of breast cancer, and it's a pretty rare indicator of breast cancer, but is it worth people going to a doctor if they have breast pain?
I think so. You know, breast pain, we could do a whole separate topic, whole separate video on breast pain alone because it's so multifactorial. There's so many different things that can cause it. But I do think, you know, persistent pain anywhere in your body is something that should be evaluated, right? Because it's not normal. Again, pain is not in the breast is not often associated with cancer, but it certainly can be. And it's like your friend, it just kind of happens to be an incidental thing, right? So, but it prompted evaluation, and so we found it. So again, it doesn't ever hurt to be evaluated by it. I see patients in the clinic again daily for breast pain evaluation. Oftentimes we find benign causes, and then we just manage it in ways that are non-surgical and, you know, can be handled pretty easily. Yeah,
this was awesome. I learned so much. I hope that helped you guys. You're so articulate, and you're just so like, I mean, I already knew this because I work with her regularly in the OR and we hang out, but like, you're so articulate, you make it so easy to understand. And so I really hope that this kind of gives you guys a sense of things that you should be thinking about if you have a family member with breast cancer, or ways to be sure that you are thinking about your breasts, getting breast exams, and making sure that you're just aware of warning signs of breast cancer. If this video was useful or helpful, I hope that you guys will give me a thumbs up and subscribe to my channel. Thank you guys so much for joining me and Dr. DeBerry today, and I will look forward to seeing you in the next video. Bye.